So thank you all for joining us today. I'm thrilled to have National Care Advisors with us. My name is Emily Kile, and I practice here at the Kile Law Firm. We are in Scottsdale, Arizona, and we practice in the areas of estate planning, special needs planning, probates, trust administration, guardianships and conservatorships, and long-term care planning, doing things for Altex and VA applications. And so we have these webinars once a month on Wednesday from during the lunchtime hour to try and bring in a lot of guest speakers so that we can get lots of new information and move forward on that. If you have questions, please make sure that you type them either into the chat box or the Q&A, and we'll try to get to them at the end, or if Megan sees something that sparks her interest, or I do, I'll make sure that I raise my hand and interrupt her so that we can get that question answered. So I'm just totally thrilled to have Megan Anderson with us today from National Care Advisors. National Care Advisors is an entity that we use pretty often when we have clients who need lots of resources, boots on the ground, information about benefits planning or housing or how to get a free phone for somebody, just all kinds of services that they can provide. They are for profit. This isn't free. These are not Medicaid services, but they can help with those kinds of applications and understand the eligibility. So Megan joined the National Care Advisors in 2014. Her previous experience includes working at the Children's Hospital of Philadelphia and for a home care agency. Throughout Megan's career, she's focused on working with disabled individuals and their families, assessing their needs and collaborating with others to ensure the best possible outcomes. She holds a degree in health policy and administration from Penn State University and a Bachelor of Science in Nursing from Drexel University. She's also a certified case manager, and she has 3 boys, so we know that she is resilient and strong because she's got those 3 boys at home, and she certainly enjoys spending time with the family and visiting her alma mater. So thank you so much. I'm going to go on mute, Megan, and I'm going to let you do your thing. So thank you.
Thank you, Emily. Thanks for having us. So yeah, I'm going to start doing our presentation on proactive quality of life planning. This is a product that we offer. And at the end, I'm going to have the contact person for business development that you can contact with any further questions on the quality of life planning product that we have. But any questions in general, please feel free to ask that in the chat, and I can get to that either during the presentation or at the end. So don't be shy. Okay, so just a quick background. National Care Advisors was founded in 2008 in Ohio by Ann Kerner. And ever since then, we have grown exponentially. We are throughout the country. We have case managers nationally, and we can go to see clients throughout the country. So anywhere we meet them where they are, physically, emotionally, whatever is needed, we can work with you to do. So our services, we do special needs and elder care planning and support. We do concierge care. So what does that mean? That means maybe finding caregivers, assisting with doing vacations, handling vacations, arranging them, equipment, therapies, you name it, we can assist with it. And then litigation consulting, which is for people that are involved with lawsuits. The theme here at NCA is a goal without a plan is just a wish. So that's obviously what we're going to be talking today is developing that plan, because if you don't have the plan, there's nothing concrete that we can put into place. Best practices. So what we find is that a lot of folks will usually just jump right in with an attorney first or with a financial advisor without defining what they want for their loved one. What do they want to achieve, right? So here at NCA, we feel that we can assist with the plan, but we have a 3-pronged approach that we highly recommend. We work with case management, so with us to help get that plan on paper, working with a financial advisor, and then also working with an attorney to make sure that this plan is concrete again and that can be put into practice. If any of those three prongs are left out, that is not a solid plan. All three need to work together to get that plan in place for your loved one. So today we're going to be talking about that vision of care and the quality of life. How can we get that quality of life? I'll be talking about the payer sources at a later slide. So best practices in quality of life planning. We're going to be identifying the key life transition time periods. What are they? When are they? What do I need to do at each age for my loved one? Document the plan and cost projections. What is your plan? What is your vision? Start thinking about that, and then we can help develop how much that would cost to get those models in place. Again, the legal services to create the documents, ensure the plan is followed by successors. I'm going to be talking about making sure that these successors are fully aware and up to date on what your plan is. Discuss the plan, obtain financial planning, right? To ensure that those wishes, those models are can be carried out in the future. And then again, sharing the plan with successors. So again, creating the vision, understanding the special needs, not only for today though, but we're defining this for the lifetime. We have experience, I know it's tempting to have the family be able to create this plan. However, our nurses are able to talk about today, but also define over lifetime. Well, why? Because we are nurses. We understand the diagnosis, potential complications that can happen, the aging process, and then the life expectancy of that individual, and making sure that those models make sense. Also, the other thing is that what we can bring is objectivity, and that's very difficult for a family to be able to have that objectivity where we're an outsider looking in and can bring that as well to create your vision, to assist you in creating the vision. The essential components, right? So our quality of life vision plan has these components that we discuss in it. Obviously, we talk about the medical care, right? That's huge. We need to know what kind of care is involved, what is needed, how much care. And then, of course, we talk about, well, who's providing that care? Is it just the parents? Do you have outside caregivers in the home? Obviously, the supplies and equipment. Who provides that? Who pays for that? Housing. What does the house look like? What modifications, or any modifications that are needed, and how can those modifications be put into place in the home? Who can pay for that, right? Could a waiver pay for that? Could Medicaid? We would be discussing that. Same with transportation. In most areas, and I was just talking to Emily about this in Arizona, about how difficult it is to get public transport. There is really no public transportation in Arizona. But, discussing how to get that individual to their doctor's appointments. What does that look like? Does he or she rely fully on parents to get them everywhere? That's discussed. Vocational support. Can this individual work? Can we get vocational rehabilitation involved? Is the individual able to work? If that's going to be jeopardizing Medicaid benefits, let's talk about that. Is there a program that can protect Medicaid and allow that individual to work? Let's talk about the income limits so that we don't go over that and jeopardize benefits. The socialization. Let's make sure that this individual is getting out and about if able to, and not just sitting at home all day. How does that look? How can we provide that? And then specific quality of life factors. So what specifically does the loved one like to do? Let's make sure that we have that incorporated into these grids. Okay, so we all know this, right? So what you want to have accomplished for this individual, is it attainable? And that's where sometimes when we work with families and we start to develop these models of costs, sometimes the vision may be bigger than the budget. So what we do is we collaborate with the family. We don't just produce a document and give it to the family. We work together to ensure that that vision is going to be attainable and sustainable with the amount of funds that are available. Again, we work through together to see, well, what's a nice to have that we can afford versus what is they need this and that needs to be in the model, right? And then working through that to make sure that it's a realistic model, it's a realistic goal. Again, a plan, you need to have a plan in order for your wishes to come true, right? In some cases, but we can work through that all together. And the other thing here is to accomplish that vision, there's only 3 sources that are going to get you to where you want to be, to where you want your loved one to be. And who's going to pay for these wishes? There's only 3. We don't have a magic wand. We don't have a pot of gold that we can get, other financial assistance from. So it's going to be the unpaid family time. It's going to be third-party benefits. And then it's going to be private family and individual funds. These are the only 3 ways to accomplish your goals. In our models that we produce, we have what the goal is or what the wish is, and then we have the assigned payer source. Who's going to pay for this? Is it going to be Medicaid? Is it going to be a waiver? Is it going to have to be private funds? And that's what we have on the models that we create and that we work together with you. The models are a rubber meets road situation. We're talking about the nitty-gritty necessities, food, clothing, shelter, utilities. Who's going to be paying for all this? And then we have, the high quality of life pieces on there as well. And who's going to be paying for those? We have that all listed so that you can start thinking about, does this make sense? Is this sustainable? Is this attainable? That type of thing. Okay, so here's the timeline that I was talking about earlier. When do I need to start thinking about benefits and planning and things like that? That's all in this timeline. Birth to age 3, when children are maybe born with a diagnosis or a current diagnosis in those ages, you want to start thinking about early intervention, waivers, Medicaid, that type of thing. Then they get into the school age, and you really want to maximize what the school is able to provide. So IEP, how can we maximize that? How can you make sure that the school is maximizing what they can do? Are they doing all the therapies that are needed? Really look through and see what else IEP can do. NCA does have an education consultant. We have 2 education consultants on staff that can assist with that process if ever needed. But that's a huge benefit once they're in school that the school needs to provide. Then you're going to be starting to go, age 15. All right, now we're going to start looking into adulthood. What is needed when this individual starts with going into adulthood? What do we need to start preparing for? So that brings us to age 18, where you're going to start thinking about and applying for SSI if they weren't currently already available or didn't currently weren't eligible for it prior to age 18. You're going to want to apply for that at age 18 to deem them disabled to get more benefits. You're going to think about guardianship. That's when you're going to give Emily a call, start that process. Medicaid goes along with SSI in most states, not in every state. So if they don't already have Medicaid at a younger age, you want to start thinking about that at 18 for sure. Some states have Katie Beckett waivers. Arizona, I don't believe is one of them, but that allows for individuals or children to receive Medicaid, even if the family household income is high. So if you don't have that prior to age 18, Medicaid would be the way to go. Age 22, yep, you're going to start thinking about residential. You're going to start thinking about employment. And then SSDI for self, if the person had a work history and is able to get on SSDI, but then maintain their income to be still below what the maximum is for that SSDI. The big one on this timeline that we find a lot of people leave on the table is at the parents' age of 65 when they can retire. They leave that retirement benefit on the table for their child, for their disabled adult child. If the child was disabled prior to age 22 and their parent is either disabled themselves in collecting, is retired, or has passed away, the adult child can collect SSDI, disabled adult child. They can get half of what the retirement benefit is from the parent. But in addition, after being on SSDI DAC for 2 years, that child can get Medicare benefits, which is huge. So you get Medicare Parts A and B after being on the DAC for 2 years. And then, after their parents' death, you know, who's going to now take over and having that in place. So that's the timeline that we, that are the major points in someone's life that we can get them on benefits and maximize those benefits at all times. Okay, quantifying the benefits over time. So like I just discussed, you know, you would think about getting the SSDI DAC at age 19, if available, getting SSI at age 18, if not eligible prior, right? So when, you know, having all these on the grid to ensure that you know which benefits that the individual could be qualifying for at what age. The federal benefits are the SSI, are the SSDI. In most states, SSI and Medicaid go together. In every state, SSDI and Medicare go together. That's the federal benefit. Medicaid is state-based. Medicaid is available in every state. However, there's different guidelines, different programs, different income limits in every state. So if you want to move around, you can keep your SSI or SSDI, but Medicaid may change in the different states that you go to. Same with the ACA insurance, that's different everywhere. And then you have the other government benefits like food stamps, Section 8, regional center, that's in California. And then there are those nonprofit resources, which Anne always tells a story about how she had a client in Kentucky and the individual needed a fully remodeled bathroom. And for one reason or another, I don't know the whole story, but Medicaid wasn't able to assist with that. The waiver wasn't able to assist with that. And so we were able to call Home Depot and get a grant that was able to convert their bathroom into a wheelchair modified bathroom. And all that Home Depot wanted in return was a news article. So those are other kind of nonprofit resources that could be hard to find, but a little digging, and you might be able to find that. Yeah, so custodial care, that's a big one. That's a big one because of how expensive it is, right? So there are times when people might say, I don't want to even think about Medicaid. And to that, what I would say is, if you could just maybe do an analysis on Medicaid, what could Medicaid do for me? The reason why I say that is because custodial care, you know, nationwide average maybe $25 an hour. So if somebody needs around the clock custodial care, you're looking at 24 hours a day, 365 days a year at maybe $25 an hour average. And that comes out to about $219,000 a year. Medicaid, will cover custodial care in most cases if they find that the person is eligible to receive them. I'm not saying they'll cover 24 hours, but they will cover a chunk of that. Same with, in a nursing home. If we're going to turn our back on Medicaid, that could be, it's averaging about $12,000 a month, which is $144,000 a year. So seeing what Medicaid can assist with is always recommended from us, to do an analysis as to, well, if Medicaid can pay for my living, my residential, the group home, and then how can I have a better quality of life living in a group home? How can I make that better? And adding those little, those additional items to the grid to show if I have a companion that comes in and takes me out, and I can go and do my hobbies that I want to do while having Medicaid pay for my living and my 24/7 care, that could really be huge. So again, we would just recommend that you don't turn your back on means tested benefits, especially Medicaid waivers. And then again, Medicaid programs. So in Arizona, you have the all-tax, you have your state Medicaid. Home and community-based services is another one that you're able to bring services into your home so that they can keep you out of nursing home. And then of course, facility-based Medicaid, which is where you live in a nursing home paid for by Medicaid. And then the Division of Developmental Disabilities, which seems very large in Arizona, is able to provide you with a supports coordinator and then able to get services in place that are appropriate. And also advocating for if you feel that there's not enough services that is being provided, always advocating. Let's do more. Let's think about this a little bit more. Let's do a reevaluation and just advocating to get more services in place. The other thing is the VA benefits. And what we have found is that a lot of VA benefits are being left on the table as well. VA benefits are very complex. They don't seem to be very easy to understand, to navigate, to know what that veteran is eligible for. So you can't really make assumptions as to what somebody should be eligible for. The benefits are based on a lot of variables: income and assets, the individual, what was their status while serving. The big thing with this is that if there is a disabled child, though, there may be benefits for that child that might be being left on the table as well. So again, another area that needs to be explored to maximize benefits and ensure that you're getting all the benefits that you're eligible for, entitled to. Long-term care insurance. This is another one that can be a little bit confusing, hard to navigate, lots of hoops to jump through. So usually you can't purchase one if you're over the age of 55. If you want long-term care insurance, you're going to want to think about that much sooner than age 55. Also, once you have a diagnosis, it's no longer an option to get long-term care insurance. The other thing that we've seen is that a lot of individuals will never use it. They'll buy it and then pass away before they're even able to use it. They might not have thought that they could use it. They didn't maybe think that they were severe enough to be able to use it. How do I know when I can use it, right? So you have to have deficits in at least 3 areas of function. Areas of function could be dressing, bathing, mouth care, getting meals, things like that. So we can assist, obviously, navigating this process as well. As you know, a lot of older people obviously have long-term care insurance, and with all the hoops that they have to jump through, that can be very difficult. And we can assist with that process to make sure, again, that we're not leaving any benefits on the table, that they're all being maximized, being used. Consider staggering the start for spouses. What does that mean? So if the spouses both have long-term care insurance, then if the one spouse can start using it for in-home care, it can last. And then when that is over, that expires, the next spouse can use their plan to assist, because long-term care insurance can assist with getting in-home care. So if you have an aide in the home, you have an aide in the home, right? Might not be the best. And, I'm sure that the agency might say, well, this aide is not caring for both, right? But it is something. So it's something to think about for sure, to stagger that using that long-term care insurance. But know what you're buying for sure before you buy, and make sure that you know what the limitations are, when you can start using it and things like that. But again, something we can help navigate. Okay, and then this is something we very rarely see individuals maximize this benefit. And it's probably because they don't know that it even exists. So what is a QMB? What it does is it provides assistance to individuals, qualifying individuals, to help pay for their Medicare premiums, Parts A, Part B. And you have to obviously be within certain income limits to receive this benefit. For instance, to qualify for the QMB, you need to have an income equal to or less than 100% of the federal poverty level. SLMB is you have to have less than 120%. And then the QI is less than 135% of the federal poverty limit. So that's something that could help bring more income into the home as well, is getting this to pay for the premiums. And then the plan implementation. What good is a plan if you're not going to implement it, right? So again, documenting the quality of life plan and the costs. Going back to what's attainable, what's sustainable. And then collaborating with your attorney for the legal documents. Your legal documents allow you to say what you want from beyond the grave, right? And making sure that you're collaborating with the financial planner for the funding strategies to implement the plan. And then the big thing, obviously, is sharing this plan with your successors, ensuring that they know what you want, what is currently in place. When we do these plans, we have heard some families that say, well, I already know all of this. You've told me what I've known. Well, so now we have it in an organized manner so that the successor, who's going to pick up from you, will know exactly what's going on, exactly who to call, what medications, who are the providers, what are the equipment, who do I call when the wheelchair breaks? We have this all in an organized plan, but with the additional models to show how much it's going to cost for that individual to live for the rest of his or her life. Peace of mind, right? Having that peace of mind so that you know that the disabled individual is going to be taken care of. So making sure that you share that plan and leaving the money to get it done, if able to. Yeah, and then implementing the plan. So the concierge care, again, we can assist with getting that concierge in place. What do they want to have in their life? Let's make sure that quality of life is really high for the rest of their lives, and ensuring that that's all written down and having a form of payment. Because again, there's the 3 sources of payment. So making sure that this is a realistic plan, rubber to road, everything's in place. Yeah, and again, the maximization of third-party benefits. A lot of times we will see that someone might have a benefit, but it's not being used, not being maximized. So how can we maximize that? What else can the waiver do? What else can the home and community-based services do? Let's make sure that that's in place, okay? That's doing its job. The supports coordinator, let's make sure that he or she is doing her job to get everything in place. Support of the successor guardians, again, making sure that they have a copy of this plan, that there has been discussions to have everything in place. And then the need for supported decision-making, guardianship protection, making sure that's in place at age 18 if needed. And then the problem solving and solution So whenever there's a problem that comes up, what is the solution with that? Let's try and think outside the box. Let's try and be creative to think of other ways that we could solve issues, solve problems. Let's work together to do that. And then again, a goal without a plan is just a wish. And we can assist with getting that plan in place. Karen Kozak is our VP of Business Development. If anyone needs, her contact information is here. If anyone would have questions after this, please feel free to reach out. And does anyone have any questions currently?
So thank you so much, Megan. I don't see any questions yet, although sometimes they pop up as we continue.
Sure.
I think one of the things that you talked about is really like just struck a chord with me, which is making sure that you have it in writing. We talk a lot when we do special needs trusts about you can do like a memo of intent or a memo of instruction. And while it might not be legally binding, it's the perfect place to put, you know, my kid is allergic to green beans, or you need to make sure that there's always a light on, or they don't like to wear long sleeves. Because what all that information that parents have up here, you know, or the kids have about mom or dad, we need to get that in writing, because there's no way otherwise for somebody else to know what it is. And then I think the other piece is sharing the information. You know, people feel so protective of their estate plan, of their, you know, the information about what services their person gets. Well, if you don't tell the successors, this is where you can find the documents and you're the person named, we just lose so much time, right?
Exactly. Yep,
Yeah,
exactly.
in that switch.
So again, implementing the plan. Yeah, crucial.
Yeah. And so when you said, you know, people are like, yeah, well, I already knew all this. Well, that's great. But did you have it in any format in which somebody could actually follow the map?
Absolutely. That's it. And that's exactly what it is.
Yeah.
Mm-hmm.
So Joyce, I see that your hand is up. If you can type your question into the Q&A or the chat, that would be terrific. Oh, I see it here. So it says QMB information didn't include freedom to work, wondering why, since you can pay a small premium and still maintain Medicaid eligibility. So
yes.
Yeah. Do you?
Yeah, I apologize. That should have been added. That's $35 premium. Absolutely. That's a huge benefit. And yeah, when we discuss that with individuals, we would have that discussed on there and then have that as part, right? That would be part of their model. That'd be part of their cost, would be the $35 a month for the premium. Yeah.
Yeah. And I think the other part of that is that we do have freedom to work plans. So somebody could work, and even if they work a lot and their benefits might be suspended, we know that lots of folks who have some disabilities might be able to hold a job for a very short period of time, right? And then the anxiety or change in management, whatever it might be, makes it difficult for them to hold that job. So then they would continue and, you know, get back on their SSI, but they've built quarters towards Social Security disability, which leads to Medicare, which is, of course, the golden standard to have that fantastic health insurance.
Yes, absolutely.
So one of the other questions from Denise is, when you do the plan, what's the format? Is it electronic? Is it a binder? Is it written documents? Can you help us understand what that might look like?
Absolutely. That's a great question. So what it is, it's a Word document. And what we do is we do a head-to-toe assessment. So we talk about the speech, communication. We talked about cognition, behavioral, nutrition. We talk about their personal care needs. We talk about their gross and fine motor. We give a list of their medications, a list of their providers, a list of their equipment. We talk about housing, transportation, education, vocation. What are the family considerations? What caregivers are in place? Who's caring for this individual? Who's running the show? What benefits this individual has? And what benefits could this individual be eligible for? We talk about all of that in one document. Along with that document comes 3 models, 3 future vision models that you and the case manager discuss together to come and to collaborate with visions or, models that you want for the individual. So for instance, a lot of times families would like to see, well, how much would it cost if my child were to live in a group home paid for by Medicaid, but then we have some quality of life factors on top of that. So that could be a model. Another model that we do quite frequently is a private pay home for someone to live in. What does that look like? If I'm paying $10,000 a month, what else would we need? Anything else? What else will we want for my child with that model? Again, you're working collaboratively. What do you want? What is best for that individual? And then, what about 55 plus? What are we talking about when we're aging? And is that going to be a skilled nursing facility? Is that going to be an assisted living facility? So those are examples of models. But we've also done models where they live in their own apartment and then have supportive care come in and assist with that, making sure they can work, right? If they can, or a day program if that's more appropriate. Things like that. So that's what you would be getting is 3 models along with the report.
Okay. And then one of the questions is about cost. And so since we're not doing a marketing program here, it's just information. And I think it's information that's so important whether a person uses National Care Advisors or not, to realize that, oh my gosh, these are all the things I need to think about. And I do need to put pen to paper and get this information down. Who are their doctors? What are their allergies? What benefits do they receive? I always joke with my clients about in their letter of intent to have who the support coordinator with DDD is, and they start laughing since it changes every week.
Yep,
so
it does.
Right. But it's
Yep.
important that that's why you have it in a format that you can update as things change. And maybe they're on the group home has changed. They were in one DDD group home and then they've moved to a different DDD group home. So you want it in some sort of format, which you can continue. Karen Kozak has kindly put her direct number as 480-285-8490. So if people have questions directly for Karen to answer about cost and timing, you please feel free to reach out to Karen. We just wanted to make sure that people knew that there's this resource that is available. And as Megan has said, like, these are the things you really need to think about, whether you use a professional or not, in all of these areas of life. And again, you all have it up here in your nice brains, but we need to get it in a place when we can't talk to you anymore about what is needed. For those of you who know me and have heard me speak before, I lost my dad very suddenly when he was 57 years old of a heart attack. And he did everything. He did all the taxes for my parents. He did them for us. He planned all the family vacations. He dealt with the CPA and the financial advisor and the estate planning attorney, paid all the bills, dealt with all the mail, all of that stuff. So not only the horror of losing him so suddenly, and he was a phenomenally fantastic human being, but then trying to catch up on all that stuff that he again had in his lovely brain, but we didn't have any of that information. So I just, I had told myself after that awful experience that my most important message as a professional is we don't know when tomorrow is the last day. And so the information that your family and friends need to know about you and your loved one needs to be in an accessible location with the details so that we don't end up in that terrible situation when we're trying to play catch up. So I thank you so much for coming and speaking to us today. It's great to see you. I hope you enjoy your trip to Arizona.
Thank you.
Thank you all for joining us today. We hope that we see you next month as well. If you need anything from us or anything from National Care Advisors, you certainly have our contact information. And of course, now you have information and contact information for National Care Advisors. So wishing everybody absolutely the best, and we'll see you soon next time around. So thank you all so much.
Thank you, Emily. Take care.